It's affecting so many people so quickly. And I think that's what's so hard to see is just the shock people have. They don't realize how serious it is.
With this fourth surge of COVID cases and hospitals understaffed, travel nurses are being called in and getting a firsthand look at how bad things are in Louisiana. Good evening and thanks for joining us. I'm Sharice Gibson.
And I'm Katie Moore. The number of people in the hospital with COVID is forcing facilities to call on travel nurses to fill those staffing gaps.
As Mike McDaniel explains, those nurses play a key role when it comes to providing care.
As a nurse from South Mississippi, Abigail Jacobson is getting familiar with new territory at Ochsner Medical Center in New Orleans.
And the hospital I worked at was smaller than here, but the biggest one in the area.
4 years in nursing and wanting experience at a larger hospital, Jacobson became a traveling nurse, landing at Ochsner back in February. It just happened to coincide with a pandemic and staffing shortages.
And there are definitely times, especially like the manager or the charge nurse, you hear them stressing over trying to get staff.
Jacobson spends her 12-hour shifts in one of the hospital's COVID ICUs, which has about 36 beds and stays pretty full.
I don't think people realize how truly sick people get and how quickly it happens. Try to plan your day as best as you can, but usually it ends up taking a hard left turn somewhere.
Jacobson is just one of the travel nurses hospitals like Ochsner are using to fill staffing shortages brought on by a surge of COVID patients.
We've done our level best to get and keep staff.
Dr. Brian Moore, a cancer surgeon at Ochsner, says because of the competitive marketplace, being able to attract travel nurses like Jacobson makes a difference. He and other doctors have even worked as nurses' aides to help when needed.
Empty trash cans, empty urinals, record vital signs in the computer, and just do some basic stuff so that they can focus on really taking care of the patients.
That's exactly what Jacobson is focused on, but it doesn't come without challenges.
I definitely think the emotional part's the hardest part.
With the amount of personal care needed, she connects with COVID patients daily, trying to alleviate fears, but also mindful of reality.
I think it's easy to ignore it until it's part of you, and then whether it's you or your family, it's too late.
While new to the hospital, Jacobson isn't new to patient care, and for her, that's what matters. Mike McDaniel, Eyewitness News.
Well, Jacobson has already extended her contract at Ochsner through December and is thinking about making New Orleans a permanent move.